My name is Elizabeth Wagura. I work for Caritas Microfinance Bank. I'm a relationship manager for the health sector. The Catholic Church has gone through very difficult times for the last few years in health financing. And this is majorly because of the challenges of transitioning from NHIF to the current ShwAAri. And hospitals have had difficulties procuring commodities, paying salaries, and so forth and so forth. And we realized that the hospitals were not sustainable anymore. And beside that, the Kenyan people have been struggling to access care. And this now, as a church, we thought of looking for a way of complementing the effort being made by the government to supplement that effort by having CARIMED, so that people can access care and the health institution can become sustainable.
My name is Sister Esther Mwangi. I'm a little sister of St. Francis, and currently I'm the CEO for St. Francis Community Hospital, Kasarani. St. Francis Community Hospital is a level 5 teaching and referral hospital. We see both general and highly specialized. We offer both general and highly specialized care services, ranging from outpatient, the general care, every line in the obs-gyn, internal medicine, orthopedics. We have also currently done so much on neurosurgeries or neuro-related. We are very good experts now in on matters pediatrics. So pediatrics, we have both general pediatric, we have intensive specialized care for pediatrics and newborns. And lately, we have also started cancer services. We look forward to establishing very soon in the near future to be doing now the open heart surgeries. We are getting ready for that. CARIMED insurance product, I started hearing long ago when it was on the incubation period, when there was this idea that the church can come up with an insurance that is friendly to the general population, targeting everyone, those who are in the low income, middle income, and even upper income. And the Archdiocese of Nairobi Medical Office, they highly involved us. All the time they were calling us for these consultative meetings when they were designing these products, and we always made sure that we have given the best of our staffs to go and give the information qua ground. How are things qua ground? How are the other insurances performing, and what are the needs? What are the exact needs in matters health financing? Because we are the ones who deal with the patients all the time, and we are the ones who deals with the community all the time, and we are the ones who are delivering the healthcare services. So we were key stakeholders in the development of that product, and when it was being launched again, we were invited, and once the product came out, we were so excited about it, and we were called for a meeting, of course, all of us, to go and get this product launched. But after that, we still went ahead to call to invite people from the Archdiocese of Nairobi, the medical office, to come and train our staff on these CARIMED insurance, and not just our staff, very many groups. We also had a day when they trained the consultants, because they are the ones also who are with the patients all the time, and they needed to understand this product.
My name is Father Ruben Jagi. I am a missionary priest from Servants of the Sea Comedians, that I work here at St. Peter Catholic Parish, which is at the Archdiocese of Nairobi. And we, other than the parish, we have a small dispensary, a level 2 dispensary that is now 2.5 years old. And we are handling the outpatient services, and also we are doing mother health care and also immunization of children. I must say that I was lucky because I think I was among the first people who were called for a meeting at the Archdiocese, and the CARIMED insurance was introduced, and the way it was introduced by the Archdiocese and Caritas Bank, it really attracted me, and I came shared with my colleagues, and I remember the following day we had a clergy meeting, and I also introduced the same to the clergy at our deanery, Royal Deanery. So from that point, we were called for a meeting again to launch now the insurance. I was there, I was in attendance, and I must say that since that time we've been so glued to CARIMED insurance.
I'm Edwin Mwangi Getao. I'm the finance officer, Jama Mission Hospital. The hospital has been in operation for over 40 years. It started as a maternity hospital dealing with teenage mothers. Considering the location we are in at Uhuru Estate, and we have Kiambio Slum and around Don Home, and we had a lot of teenage mothers, and the sisters who were back then saw the need for the children to be incorporated at the hospital, where they will get the good care for the maternal health. And from that, the hospital has been growing for over years, and now we have both outpatient and inpatient. We are a level 4 hospital, and we have a bed capacity of over 65. The first time we heard about CARIMED, I was attending a meeting at Cardinal Tunga Plaza for KCCB. I was representing the hospital admin, and during that time we were in a process of our staff cover, insurance staff cover was due for expiry, and someone mentioned that we have a new product from the Caritas called CARIMED. I think it was Patrick Arike, the KCCB coordinator. That's how I heard about it, and I got interested, and in fact I approached him and telling him how the hospital is in the process of renewing the staff cover, and we might get interested in the new product since it's within the Archdiocese of Nairobi. And from that period, we engaged a lot with the personnel. Majorly, we had one, Patrick, and there was another one called Elizabeth Wagura. Those are the two people who we have interacted with a lot, even materializing the CARIMED to be on board. Initially, we had other insurance who are covering our staff, and we needed to support even at least for us financially, we needed to have a product that will be considerate in so many aspects based on the number we have. We have over 131 staff, and the dependents and the beneficiaries of that are over 350. So considering our number, we were looking for a product that even the premiums will be sustainable as a facility. Looking based on the economic times we are having, we needed something that should be affordable to us as a facility.
Our hospital being a level 2, we felt that we can be more identified with CARIMED, because we realize that it's taking care of even the small medical institutions, and our interests are catered for, and also the fact that it is a church instituted insurance, and also with Caritas Bank, a bank that we've worked with for long, also with the Archdiocese, and we felt that this is the right way, the right route to take. That's why we have always felt that we are where we're supposed to be with CARIMED insurance.
With CARIMED, now everybody should be able to afford healthcare because it has options for everyone. From the one who has not been employed to the ones who are employed, the ones who do not have a high income, those who have like low income, middle income, upper income, everyone has a product that suits them. So that's how we came to understand CARIMED insurance and to promote it among our staff. We have had very many meetings with our own staff members on creating awareness on what is CARIMED. And we also look forward into also providing the same cover for our staffs come next year.
This is our product, and we needed to support it. We felt that we needed to be like the other facilities will benchmark on our facility. We needed to support it, and the approach the CARIMED staff had to us was very good, was very welcoming, because looking for the premiums that we were quoted, it was like half of the other insurances, whatever we were supposed to pay. And with this economy, we had to take it up. We had to just decide, let's go with it. We work with it. I know it's a work in progress product, but we are there to support the product. That was the main motivation. And then we needed, of course, our number is big, and the premiums we were paying previously to other insurances was very high. And for CARIMED, it was accommodative, and even how we were supposed to be funded, we were funded by Caritas Bank. It was very easy. The process was very easy, and that's the main motivation.
One thing that is so unique with CARIMED, the issue of the way the classification of the services to the families, if you have a family of 2, if you have a family of 3, that is an amazing idea, and that gives the CARIMED insurance a weight. And secondly, the issue of years. You realize that when you talk about other insurances, there is that capping of years. But there is a provision with CARIMED, there is a provision of even when you are 90, 100 years, that provision is there. And some of us, when we are here in Nairobi, would like to take care of the insurances of our parents. And some are very old, some are 90, some are 80. So we have a way out. And CARIMED is answering now our many years prayer. So it's a dream come true, it's a prayer answered.
It is a household product targeting all sizes of families, including the elderly persons. You realize majorly people who are elderly have difficulties to access a health insurance. So that makes it very unique that every elderly person can be able to access health insurance by paying a premium that is affordable. The waiting period for the cover is short. It is only 14 days and people can be able to access cover. And it doesn't discriminate even if someone is having a chronic condition. This makes CARIMED to become unique in its own way, and it is a low-cost model, making it affordable and accessible for all families.
On the registration, we have started treating them successfully. So we were among the first people in Kenya to treat the first patients on CARIMED, and we were so happy about it successfully. Patients were admitted and they got treatment from outpatient to inpatient. Right now we are seeing an increased number of patients who are coming to seek treatment under CARIMED. So far we have treated over 10 patients under CARIMED successfully. So it's such a success to us, and we are really praying and working very hard to ensure that a big number of patients who come here, at least before they go home, they have heard something about CARIMED. And every day we have an average of about 250 people. Those are patients in the outpatient, so add their relatives and those who are coming on visitation. In this compound every day there is about 500 people roaming around. So be it the relatives, friends, students, those on attachment, and our own staff and everyone. The CARIMED thing, even when you go to our walls, like on my notice board, you can already find this information on CARIMED. So we are sharing this information and creating a lot of awareness, and we are very happy with this product.
The vision of CARIMED is, first of all, to see there is equity and access to healthcare for everyone in the country, and especially the people who are excluded by other health insurances. And our desire as a church is to ensure that across the country, everyone can be able to access cover at a household level. Number two, we would want to see that the health sector for the faith-based institutions become sustainable by ensuring that the payment for the services that have been procured have been paid on time.
When we are many, we have the tyranny of numbers, we have the scope, we have the economy of scale, and together we can have a bigger scale and a bigger voice. And together, if we join together as all the church or Catholic institutions and hospitals, we can make a difference. If we decide today that all the church, hospitals and medical institutions will join CARIMED, you cannot imagine the impact we shall create. So the secret is working together, joining the insurance together, all of us together, and gaining that the tyranny of numbers and economy of scale. We join all of us, we make great impact in the whole country.
Faith-based hospitals, they are our colleagues, we are brothers and sisters. If you have not registered to be empaneled on CARIMED platform, you're already very late. If you've not understood this product in such a way that you can explain with ease to your staff and to the patients, you are still very late. So I'm urging them to have interest, create interest. The CARIMED offices are always open. So they need to understand, to get this information. Invite them. For us, anytime we invite a team from CARIMED and from the Archdiocese of Nairobi to come and train us, they are always available. And because of that, it has made us to understand this product very well. So when we're explaining to patients, we are not struggling.
We wish to transform healthcare by, first of all, improving on the liquidity of the health institutions. We want to see hospitals that are well stocked in terms of commodities, health workers who are being paid on time and they are paid well, so that they serve the people of God with joy and gladness. And at the same time, we want to see patients going to hospitals, getting treated and going home happy. And with that, we are going to make health system in the country to become something that everyone can be proud of, those within the government and those within the churches.
Karibu CARIMED, karibu nyumbani.
Karibu CARIMED, karibu nyumbani.
Karibu CARIMED, karibu nyumbani.
Karibu CARIMED, karibu nyumbani.